Colon cancer, also known as colorectal cancer, is a type of cancer that begins in the large intestine, which is the final part of the digestive tract. Patients typically experience symptoms like persistent changes in bowel habits, including diarrhea or constipation, and blood in the stool, which might appear bright red or very dark. Other signs can include abdominal discomfort, unexplained weight loss, and a persistent feeling that the bowel doesn't empty completely. Treatment often involves a combination of surgery to remove the cancer, chemotherapy, and radiation therapy, depending on the stage and location of the cancer. Risk factors for developing colon cancer include advanced age, a high fat diet, a family history of the disease, and certain inherited genetic disorders. Here's a more detailed exploration of the various aspects of colon cancer, from diagnosis to management and prevention. Symptoms and progression of colon cancer. Colon cancer typically begins as small, non-cancerous clumps of cells called polyps that form on the inside of the colon. Over time, some of these polyps can become colon cancers. The progression of colon cancer can be slow, often taking years to develop. Early symptoms may include changes in bowel habits, such as constipation or diarrhea, blood and stool, persistent abdominal discomfort, such as cramps, gas, or pain, and a feeling that the bowel doesn't empty completely. As the cancer progresses, symptoms can become more severe and may include weakness or fatigue, unexplained weight loss, or jaundice. Regular screening is crucial because symptoms often appear only once the cancer is more advanced, thereby reducing the chances of successful treatment. Early detection of polyps through screening can prevent the development of cancer. Diagnosis of colon cancer. Colon cancer diagnosis is pivotal for effective treatment and better outcomes. Early detection often involves screening methods such as colonoscopy, which allows doctors to identify and remove precancerous polyps before they transform into cancer. For those with symptoms or at high risk, diagnostic tests also include blood tests for specific biomarkers, stool tests for occult blood, and imaging tests like CT colonography. Genetic testing is additionally crucial, as inherited syndromes like Lynch syndrome significantly elevate colon cancer risk. Timely and accurate diagnosis can significantly alter the disease's trajectory, transitioning a potentially lethal condition into one that is manageable or even curable. Cause and risk factor of colon cancer. Colon cancer arises from the abnormal growth of cells in the large intestine or rectal areas. A major risk factor is age, typically occurring in individuals over 50, although it can occur at any age. Genetics play a crucial role. Familial history of colon cancer or polyps significantly raises the likelihood of developing the disease. Lifestyle choices are impactful. Diets high in red and processed meats, low in fiber, coupled with sedentary habits, obesity, smoking, and heavy alcohol use, further increase susceptibility. Moreover, certain genetic syndromes like Lynch syndrome and conditions like Crohn's disease and ulcerative colitis also elevate the risk of colon cancer. Understanding these factors is essential for preventive measures and early detection. Treatment and management of colon cancer. Treatment and management of colon cancer involve a multidisciplinary approach tailored to the individual based on the stage and location of the tumor, as well as the patient's overall health. Surgery is typically the primary treatment for early-stage colon cancer, often followed by adjuvant chemotherapy to eliminate residual cancer cells. Advanced stages might require more extensive surgery and could include a combination of chemotherapy, radiation therapy, and targeted therapies to block cancer growth on a molecular level. Immunotherapy is also emerging as a promising option, harnessing the body's immune system to fight cancer. For optimal outcomes, treatments often incorporate dietary changes and lifestyle adjustments alongside psychosocial support, ensuring a comprehensive management plan that addresses both the physical and emotional impact of the disease. Regular follow-up is crucial for monitoring recurrence and managing side effects of treatments.